Right. Thank you, thank you, thank you. Good evening, good afternoon, actually, still, everybody. Thank you for joining us. Thank you, thank you. We'll give everyone a second to get here and join us on a very, very special birthday edition of Brandon's Briefing. Thank you all. Thank you. Thank you for the birthday love all day. I appreciate it. Thank you so much. Gives people a couple more minutes to get here. Hope everyone's enjoying the day. Got outside a little bit, socially distancing, of course, but enjoying the wonderful, wonderful weather that we had today. Thank you all for the continued support. Hope everyone has been safe. Thank you so much. We're going to give everyone a second to join us here, and then we will get started. Thank you. Give everybody a second to get with us, and we will get started. The weather was beautiful today. It's like the hardest day to be quarantined. I'm telling your sister that you said that. Absolutely. I'm screenshotting that for sure. All right. Just another 45 seconds, everyone, and we're going to get started in just 45 seconds. I want to thank everyone for joining us, making sure. If you got your questions, get your questions in. We will get to them in a few minutes after we go through everything. Thank you for joining us again. 25 seconds and we will get started. Thank you, everybody. All right. Good evening, everyone. Welcome to Brandon's Briefing, another Brandon's Briefing. Want to, as always, thank you all for joining us here as we're live on Instagram and on Facebook. So thank you for joining us. To all, we want to make sure that everyone is being healthy and being safe. Happy Passover to everyone celebrating. We're going to get started with the information. So we'll go from there. First and foremost, we are now up to 5,529 cases in the state of Maryland of COVID-19, with 571 happening here in the city of Baltimore. So we know that this crisis is continue to be very, very serious, and we have to take it serious at every cost. So remember to always socially distance yourself, stay apart, follow the rules at every single turn so that we can keep you healthy, safe, and alive. You can keep your family, your friends, those that you love and care for, healthy, safe, and alive. I wanted to quickly do a policy paper recap. Yesterday I outlined policies that I believe the city needs to go through itself, but also partnering with our state and federal partners around that. You can actually find it at baltimorecitycouncil.com. Click COVID-19, and then it has a direct link for you right there that says supporting Baltimore during and after COVID-19. Click it, and it'll lead you right to our policy document. So you can get that immediately from us. So I'm just going to go through some quick highlights of that, of what I proposed yesterday, and then go back into COVID-19, more COVID-19 related stuff. Expanded unemployment insurance. I'm going to continue to advocate for that above us at the state and at the federal level. We know that everyone's being hurt by this, and people who normally work and have worked their entire lives are not able to do so. We know there are going to be more rounds of federal stimulus, and I'm going to advocate on your behalf to make sure that we're expanding how we can help out those who are not working. Also, you may have seen this on the news last night. I am proposing to use a small portion of the city's rainy day fund in order to help stabilize Baltimore, in particular, help particular communities in Baltimore. We know that our rainy day fund has over $140 million. And yes, we're going to probably have to use that to help out with the city's shortfall that we're going to face. But we also have to have a deep understanding that when we're in a situation like we've never seen before, I don't think that anyone watching, anyone in the city of Baltimore would argue that this is a rainy day if we've ever had one. And when you're going through situations that you've never been through before, extreme circumstances calls for extreme and drastic action. That's why I'm pushing for us to do that. It would require a change of policy at the Board of Estimates level that would allow us to use the rainy day fund for outside of city government benefit. But I believe that we should do that, and this is how I think that we should do it. So, first and foremost, $3 million of our rainy day fund to help reduce homelessness in the city and help relocate those people and get our citizens who are unfortunately homeless in a better situation as far as stable housing. $10 million to establish a loan fund for businesses in the city of Baltimore. We know that businesses across the city have been hit every sector, and we need to make sure that we're helping them in every single way that we can. $4 million to benefit our nonprofits and cultural institutions. We know there are nonprofits across the city that do great work, great work working with our young people, helping seniors, helping people get back into finding work and employment that simply are struggling right now because the folks that they get their funding from are not funding. So we have talking about people not being able to live a service, and another group of Baltimoreans who are losing work because of that. And then also we know we have great cultural institutions in the city. Our theaters, we have great places like that. Thinking about like also Art Social Club. You're thinking about all these places that are struggling. Our museums, we have to figure out how we can help them as well. But then what I think is the most important portion of this, in my opinion, is $8 million for a workforce development program geared towards people who lost their jobs as a result of COVID-19. And there are many of them who probably their jobs may never come back. The city should be investing in taking these people who have worked their whole life, who never don't want to work, and figuring out how we can train them and get them employed in jobs that are here now and ones that we know are going to be here in the future. That is just a quick highlight. I am also suggesting that we tap into the city's Children and Youth Fund to help support and break down the digital divide. We know we have thousands of young people in the city who are at home right now, and our school system doesn't have enough laptops. We should spend millions of dollars to help break down that digital divide and also expand the way that we're going to feed our young people. And then the last thing I will uplift is that I'm also asking that we use the newly created Neighborhood Impact Investment Fund, better known as the NIF, to directly benefit businesses and workers from the most challenged neighborhoods in the city of Baltimore. So want to make sure that everyone goes again to BaltimoreCityCouncil.com, click COVID-19, and click supporting Baltimore during and after COVID-19. We'll push that link in the chat for you so that you can have that information. Want everyone to check that out. Next thing I want to talk about really quickly, gloves and mask and safety. Everyone should know by now that when you're outside, wear a mask. If you have one, you can make one. There are YouTube videos on you can make one. You may have seen a meme of me posted onto a Wu-Tang 36 Chambers album day with my mask on that I actually wear when I go outside as well. We want you to be safe at every turn. But also, I want you to also be mindful of what we're doing with the things that we're using to stay safe. I'm tired of getting pictures and calls from people about people leaving gloves on the ground at a supermarket, in the street, outside of their car. Be responsible, everyone. Throw them in the trash so that we can, again, help to slow the spread of this virus. Proper use and disposal will help us bend the curve so that we can have less people getting sick. Just remember all the mandates that you have. You shouldn't be outside unless you absolutely have to. You shouldn't be going to businesses that are not essential. If you see businesses that are open that are not essential and shouldn't be open, report that to 311. if you see businesses that are not forcing people to adhere by the standards and the things of social distancing and other things, report that to 311 as well. Also, let's see, other questions. Resources, just a reminder, you can find all of the resources available in the city simply at our website for our resource map, bit.ly/BeMoreCovidMap. That's bit.ly/BeMoreCovidMap. Also wanted to give you guys some tips again for our senior citizens. We need them to be safe. If you can help out a senior that you know that you're related to that lives in your neighborhood, try to prevent them from shopping at all costs. We don't want them out. We want them to stay at home. But we do have some tips. Number one is don't go out if you're a senior citizen. So make sure your parents, your grandparents, everyone know that you will help out. You will help out with your neighbors and deliver their groceries. Two, consider delivery. So there are many, and we know that is available on our websites. Many of our food markets offer delivery services, and we know that, for example, Klein's ShopRite is waiving fees for that. Three, for our senior citizens and people with special conditions, if you have to go out, take steps to protect yourselves and others. So go during the older hours, wear a mask, avoid close contact, don't touch your face, clean and disinfect at the store, wash your hands once you get home, and clean and disinfect once you get home. And if you're 60 and over and need assistance with grocery or meal delivery, call 410-396-2273. Also, this next stuff is very important, everyone, so listen up. This is for everybody. We got updates today from both Safeway and Giant about what they're doing as far as allowing people into the stores, right? So give me 1 second. I'm going to make sure that information gets in there. All right. So, for example, this is what Giant Food is doing. So all the Giant Food stores in the city, they will be closing reduced hours on Sunday, April 12th, on Easter. They will be closing all of their stores and pharmacies at 3 p.m. on Sunday, and they will reopen on Monday, the 13th, at 6 a.m. Thursday, starting tomorrow, everybody, starting tomorrow, they will begin limiting the number of customers in our stores at any given time. They can reduce the store capacity to 20%. They will be having store associates monitoring this, and they ask for your help by adhering to the policy change. That means when you go to the store, only a certain amount of people are going to be let in. They're going to ask everyone outside to wait. You've seen at some other stores. We know that Safeway is doing something very similar as well. They have to make sure that everyone's being safe. If you didn't see, there was a young woman who worked at a Giant Food store in Maryland that actually died from COVID-19. So this is a very, very serious thing. We want everybody to adhere to those rules and regulations, because we know that we want everyone to get their groceries, but we also have to do it in a safe way. This is why I'm also asking you to try to shop for longer periods of time. If you can, try to avoid going to the supermarket consistently. Try to do it as less as possible so that we can make sure that these things continue to not spread in the way that it has been. Again, reminder that you can find all the food distribution stuff for city schools on our COVID map, but also at baltimorecitysschools.org/health updates. And you're also on the school system website. If you are a parent of a school system student or know someone, be sure to fill out the needs assessment that they have here. Remember, there will be no trash pickup on Friday in the city. You'll have a rescheduled day, and then also for Easter Sunday, visit BeMoreChildren.com for information on meal sites and times. So, with that, I am going to turn over to some questions. First question: how much longer will this last? We don't know. Might as well settle in for the long haul. We will get out of this when the public health professionals tell us we can get out of this and it's safe for us to be out of this. This won't happen quickly. We should understand that, and we have to understand that while everyone is impatient, everyone wants to be outside enjoying the nice weather. We want people to live, and that's the most important thing that they can do. So everyone's just gonna have to buckle it down. Somebody said, "What about people paying rent in BGE?" So we know that BGE isn't doing disconnections at this time. Even though the city council actually passed a resolution asking the governor and the state to forego people paying rent right now, you still have to pay it, even though you can't be evicted. So if you can afford to do it, please do it. If you can't, people understand you can't be evicted at this time. We'll have to figure out ways to help you. And this is one of the things that while we're advocating for more direct payments from our federal government to help people understand that people are hurting everywhere, and they're not trying to, get over on their landlord or the people that they get their utilities from, but they're simply just trying to figure out how they're going to survive. So someone asked, is the curfew over? There is no curfew. There was never a curfew that existed. This is what we call the governor's mandate. Is essential. You should not be out no matter what time it is, what time of the day it is, unless you're doing the essential things. And in case people haven't been paying attention, they've been getting more and more serious about people who are violating the governor's rules, people having parties at their house, all kinds of crazy stuff that we continuously see happen. So please don't violate that. Follow it. Don't have a bunch. Listen, Easter is on Sunday, everybody. Easter's going to have to be like this. It's going to have to be digital. You can't have 15, 20 members of your family over. Only have it with the immediate people that live there. Make sure that you're protecting yourselves and your family. Go to worship on the web. We need everyone to be safe. So that's what's happening. There is no curfew, but we need people to use common sense. Someone asked, do I think that the virus will disappear once the temperature rises? No, I don't. I think that what they're saying is that it doesn't respond that well to heat, but we know that this virus is something that they don't totally understand yet. So what, again, we're going to do is always listen to the public health professionals and where they are at that time. All right. So a gentleman that has a senior that doesn't have electricity and can't hear, you should send us a direct message so that we can try to get in contact with you, so that we can try to get that individual some help. So thank you for that. Thank you for that. Someone asked, what's the process of implementing my COVID initiative? So this is a great question. It depends. Some of them are going to be legislative initiatives that have to happen at the local level. Many of them are us advocating at the state and the federal level, and that's a lot of advocacy. But for example, to change the way that we use the Baltimore Youth Fund, that's going to require local legislation that we're going to have to pass at the council level. To change the way we use the rainy day fund, that will require me and the majority of members of the Board of Estimates, which is made up of myself, the comptroller, the mayor, the city solicitor, and the DPW director. So it just depends on the particular one, what has to be done at what level. See, that's someone said that someone's having a Zoom Easter dinner. That's their family has scheduled a Zoom Easter dinner for 2 hours. That's an absolute wonderful way to do that. So someone said, why isn't the city hiring a disinfecting service for essential services? So because the city itself we have employees, folks who are disinfecting. As you saw a couple of days ago with the Southwest District, they came in and cleaned and disinfected that district as well. So all of those things are being taken care of, and we're going to continuously push to make sure that they're happening in the best way possible. Let's see here. There's some more questions coming in here. Give me 1 second. One second, everybody. All right. So there's a question that came in right now about in NVA. So actually, if you go to our website, we have a link where you can see about what's going on with NVA and what they are suspending and what they're not suspending. So you know the NVA is essentially shut down at this point. So you should be sure. We'll send you that link. Send us a direct message, and we'll send you that link so that you can get that direct information from us as well. All right, there's another one coming in now. Give me a second. Someone asked the question, how will the city be able to keep the youth off of Pennsylvania Avenue? So this is something that we've heard a lot recently, and we have to understand that make sure that people are adhering to the advice, and we also have to make sure that our young people are following it. And what I have suggested to the police department is figuring out ways how they can keep people safe, but not going back to the things that they did in the past. And what we're continuously saying to them is that also there is an existing youth curfew where when young people are picked up, them and their families are referred to services and not criminalized. So we have to figure out ways for them to keep people in line. So someone said, is there any way to ensure that black communities will receive the proper care and not be discriminated against during this crisis? That's an excellent question. So this is the exact reason why I push for that legislation to have the data shared, breakdown by race, right? Because we know that in Baltimore, a city with some of the most historical and biggest inequities ever, that you have to understand things through a lens of race, through a lens of zip code, and even gender. And when you're doing that, then that allows folks like myself to push our health department and the other agencies to treat this virus through a lens of racial equity so that they understand. Because when you live in Park Heights versus Roland Park, your life expectancy, your pre-existing conditions, all those things change and are different. Let's see. Someone says, well, I can't, but yes, the city police does have the authority to enforce the youth curfew. Then someone said two questions from the same person about what's being done about the police officer that coughed in the citizens' faces, and why aren't they charged as civilians even when there's evidence? So it's a couple of things that they're going here. First and foremost, it was me. Thankful to our Instagram followers that actually reported that over to the police department for action is inappropriate, unacceptable. A public servant shouldn't be doing something like that. Now, what has to happen in this case? The commissioner has an investigation that he has to do. They have to go through these policies and practices that they have. There are some things called like the Law Enforcement Officers Bill of Rights in Maryland. So the police commissioner can't just say yesterday that he saw that video and he's going to suspend that person or he's going to charge that person. They have to go through an actual process. Like if anybody's watching is a member of any other working union where there has to be there's a disciplinary process that they have to go through. I'm going to make sure that you guys stay with the most up-to-date information about that and make sure that we're getting that out to you. And what I will say that in this case, like for example, we have seen officers be charged as civilians when they've done things over the last years. Remember, it was the incident when the young black officer was punching somebody last year. There's some of these things that have happened. And what I have said to the police commissioner, who of course him and his team don't work directly for me, is that this kind of action that was made yesterday during the midst of a global health pandemic is unacceptable, and they have to reprimand that person as strictly as allowable by the law. So a great question here. Are there community groups and or medical institutions working to address the strong probability? Hold on. Instagram is pausing here. All right, we're back. Sorry about that, Instagram. Community groups or institutions working to address the probability of blacks being hit the hardest? Thank you for that question, Felicia. This is actually a part of also why I introduced that bill, and now going to be pressuring medical institutions and asking them questions as I have conferences with them over the rest of this week on how they're going to look at this and attack this through that lens of racial equity, understanding what's happening across the country, but also understanding what's going on in Baltimore based on the historical things that we have here, knowing that this is a very, very high probability. So stay tuned. I'll make sure to reach out to you personally about that when we have a more clear. So someone said, will the convention center also be used for a testing center, especially for those who can't drive? The convention center is right now, again, for extra, they're using that for extra medical space. There are other testing centers. We know that there's one in Pimlico. There's testing available at hospitals and other sites across the city. But as I say, each and every day, there's not enough testing anywhere in the United States of America. That's why you see everybody, local and state governments across the country, screaming, hooting, and hollering at the federal government. But again, remember, right now, only people, pre-existing conditions, those who know they came in direct contact, or those with the severe symptoms are getting tested right now. We don't want to overbear the system. For the people out of work, is the unemployment money for their family going up to support them? So we know that they increase, if they increased the amount of unemployment insurance during this last federal stimulus thing. We know we're going to be advocating for doing more, right? We're going to make sure that we continue to press upon them to make that happen in the best way. All right. Let's see. Someone asked a good question. Asked a question about how come the speed cameras aren't off, right? I actually asked this similar question myself, but you also have to remember about how they're regulated through the state, etc. And I will tell you that many in my office, believe it or not, we actually get a lot of calls from people asking for speed cameras, including from my own neighborhood, which was shocking to me. But I'm going to continue to ask them about why these things are on when school is out and in school zones. So be sure that we'll have a better answer from DOT, official one from you, maybe even as early as tomorrow. Yes, so again, remember the food sites, right? So the food site information. We know, and we're going to give you that again. We'll put the link there where you can get that, again, right in the chat. We talked about that a little earlier about where you can get the food sites during the holidays. We know that the schools and will still be doing some, but there's going to be other ones that will be limited. So we'll put the link back in there for you. So someone said, those of us who ride MTA do not have cars to go to testing sites for drive-ins only. What can you do for us? Again, first and foremost, Marie, if you are extremely symptomatic, please make sure that you call your doctor. Make sure that you actually go and try to get it, right? So what also I think that I have to understand, again, this is actually in my policy paper too, that we have to have testing site, and what we're going to be advocating for on a bigger level is that testing has to be equitable. That's why I think it's great that they're putting one up at Pimlico, but we're also going to need some in some areas where people can get to. There's also a concern from the medical community too, though. Remember that they also are trying to limit, like if people are going to be coming to get testing, the amount of people coming and converging in neighborhoods where are very high populated. They don't want to help that help the virus pop off too. And also a reminder, a great point, Andy, that there's no recycling pickup on Friday either. It's rescheduled to Saturday. So someone said that why doesn't the city shut down the transit system for a few weeks? It's actually not in the power of the city. MTA is a state agency, so the governor has severely reduced the amount of bus lines out and reduced the train hours out for us in public transportation. But a lot of our critical workers use public transportation, and we need them to get to work. So someone asked about street cleaning and when it's coming back. We've asked a question about to DPW, street cleaning and some other services that they cut that we think we might need. And as soon as we have an answer from the administration, we will get them over to you. So there states that first responders are visiting homes. Well, I researched that information. Can you send a deeper explanation of that? And we will get back to you on that as well. So your question about a water bill. What exactly about a water bill? And this is going to be the last question. So what about a water bill? So there are no water shutoffs right now. So you don't have to worry about that at all either. Those are also suspended. All right. Well, thank you, everybody. Thank you for joining us for a special birthday edition. Thank you all for the happy birthday wishes of Brandon's briefing with Council President Brandon Scott. We appreciate every day that you guys come on. I appreciate you guys coming on. So thank you. Thank you so much for tuning in, and we'll be sure to see you tomorrow. Thank you.